Okay, good morning and welcome to the second day of our Congress. And this is our plenary session, which is the gaps we live with, what patients are still waiting. This is a very important topic because we have to explore one of the most important questions of the Sjögren community. Why, despite on the progress in research and understanding of the disease, the patients do have facing so many gaps. So we have to, in diagnosis, in coordinating care, and in access to all the treatments. Now, we have two experts, specialized speakers with us, Professor Chiara Baldini, who is a rheumatologist at the University of Pisa and a leading researcher whose work was depending on our understanding of Sjögren's, and this is very important. And thank you very, very much for that, Chiara. And Coralie Peter Builo, our Coralie, board member and patient advocate, who is going to show to us from the patient's perspective what we're still missing. So please, ladies, come on the floor. Yes. Okay. Chiara, you can start. Okay.
Thank you so much, Kathy. And good morning, everyone, and thank you so much for involving me in this conference. It's simply beautiful, and I think that we spent 2 days that were really exciting. And exciting is also my title, The Gap We Live With, What Patients Are Still Missing. Because I think that when we talk about living with Sjögren, we are actually talking about the gaps between expectations and reality, not only patients' expectations, but also doctors' expectations. We have many forms of gaps. We have medical gaps, we have emotional and social gaps, we have care gaps. And in this talk, I want to discuss briefly some of them, but focusing not only on what is missing, but also trying to discuss what is changing, what we are doing together, because this is the actual revolution that we are living with. So let's get started from the medical gap. Of course, we have the problem of the delayed diagnosis. We were discussing about delayed diagnosis yesterday. It can take from 3 to 7 years to get the diagnosis of Sjögren, and one of the main reasons is the fragmented patient journey. Yesterday in the workshop, we learned a lot about that, about the role of GPs, of the different specialties, rheumatologists, and the fragmentation at the diagnosis is a real problem. Why? Because we have discussed yesterday about the complexity and the heterogeneity of the disease that can be characterized by glandular manifestations and extraglandular manifestations. But to be really concrete, what does this heterogeneity and this complexity means in terms of diagnostic delay? When you have a diagnostic delay, when the disease is unexpected, because if you take a look to this data, you can see that when the patient has a typical clinical presentation with the Zika symptoms, the delay in diagnosis is shorter, is not so long. The problems are when you have patients with unexpected symptoms, low Zika, mild symptoms, non-specific, invisible symptoms, or when you have the most severe patients. Seems a paradox, but when you have visceral involvement, extraglandular manifestations, and not glandular manifestations, in that case, the diagnostic delay can be really longer. And unexpected is also the disease in males. Yesterday, Lucio was sharing with us his journey, and when you have the male affected by Sjögren, the time to diagnosis is longer. These are data from the Harmonics project. showing that we have this gap that should be bridged in the futures. In the typical manifestations, however, symptoms are very non-specific. And again, from real life, when you compare the frequency and the intensity of the symptoms in patients undergoing a biopsy and receiving at the end of the workup the diagnosis or not receiving the diagnosis of Sjögren, these are our data, you can see that there are no differences. So symptoms are not specific because they are poorly correlated with the diagnostic test that we have in our hands. And again, to summarize what has been already said yesterday, we know the importance of the SSA antibodies, and when you don't have anti-Rho SSA antibodies, the disease can be even longer. But with this in mind, I think that we have to ask ourselves what is changing now. And there are three magic words that are a sort of take-home message in my mind: awareness, education, and communication. Because with respect to the past, we have a different awareness of the disease. And this is thanks to the work that we have done together. We are well aware now of the broad range of symptoms in Sjögren. This is the Sjögren Syndrome Foundation survey that has clearly pointed out that it's not just Zika when we talk about Sjögren's, that there is brain fog, anxiety, depression, and a broad range of gastrointestinal problems, respiratory problems, cardiological problems, and so on. And we, in collaboration with Sjögren Europe and ERN, thanks to the coordination of Coralie, we are trying now to be more specific regarding PROs in Europe in patients living with Sjögren in our realities. And I think that this can increase a lot the awareness of the disease at all the levels, from the GPs to the other specialists to the rheumatologists. Another point to take into account regarding the awareness is the focus on preclinical Sjögren to promote the early diagnosis. Of course, we know that there are preclinical stages when the disease is not overt, when we can detect the disease that it is there because we have autoantibodies, we have imaging abnormalities, and science is providing us every day new information. Think about the novel autoantibodies that can improve the diagnosis in seronegative patients. And we have a lot of new input from the basic science in this direction. But also in the clinics, we have the imaging biomarkers that are not invasive and can detect abnormalities in the echo structures of the gland earlier. In our hands, this is a powerful tool to improve the early detection of the disease. And these slides actually are telling us the importance of the biomarkers that now are in our hands regarding and focusing on the awareness that we have of the disease. We have the clinical biomarkers, we have histology, we have serology, we have the imaging, and now we have the molecular signatures. So it's not what we are missing, but it's really what we are doing now, thinking about the recent publication by the French group, by Dr. Nguyen, on how these biomarkers have helped us to understand better the complexity of the disease and the trajectory of the disease, distinguishing different gaps and different needs in patients in real life, those with the burden deriving from the symptoms, those with the burden deriving from the severity of the manifestations, and those with the biological disease activity that can prelude to the severity. These are all opportunities for personalized treatment and intervention. And we also have biomarkers for lymphoproliferation. These are the data derived from the Harmonics project, specifically linking biomarkers to different forms of lymphoproliferations. So we have medical gaps, but we are trying to close these gaps. But despite this awareness, we have to bear in mind that our patients still face emotional and social gaps. And this is the reality, because again, the most important message that I was taking from this survey was that over 50% of the patients were facing at the same time over than 21 symptoms altogether, with an overall impact in the daily life, on diet, on the work disability, fatigue and functional impairment, not to mention the personal relationship or mental health, brain fog. And combined together, all these impact, all this negative impact on the daily life means an acceptable symptom burden that can be quantified together. Today we can quantify this unacceptable symptom burden with a validated tool that is the ESSPRI, and a score of 5 or higher than 4 of the ESSPRI has quantified this unacceptable symptom burden that over the world can be detected in more than 50% of our patients. The emotional and social gap are strictly related to the care gap. And the care gap is not only, in my mind, the lack of an approved systemic therapy for Sjögren. Of course, this is crucial, but it's not just that, because the care gap is broadened as a concept. The fragmented care is not a problem only at the diagnosis of the disease, but in real life, patients outside of the dedicated clinics for Sjögren really experience multiple healthcare visits during the year with different specialists. And we face everyday difficulties in alignment. It's not just the alignment, which is crucial, of course, between patients and doctors, but it is also the alignment among the different doctors, which create this care gap. From this perspective, again, education, communication, and awareness can bridge the gap, and together we have done a lot. Think about the first conference and all the efforts that we had made in trying to align communication, the definition of flares, for example, and also the analysis of the social media to try to align communication. Of course, this is the example of flare, but it's the main message that is important. Doctors have started to learn the importance of using the same word to understand, to listen to the patients, not only to hear, but listening means also to share a common language. And also the concept of this fragmented care has been taken seriously. And the idea is to move towards a patient-centered symphony, let's say, and there are ongoing initiatives. Again, I'm involved with Coralie and Anna directly in the RN. And this is one of the examples. We have the RAREMPATH project, which is an effort taken together patients and doctors trying to optimize the current patients' common pathways that can overcome the geo-epidemiological differences across Europe in taking care of rare and complex diseases like Sjögren's disease. yesterday we learned from Valerie about the therapies and the incredible new horizons that we have for tomorrow and the importance of validated data. So to sum up, of course we have to deal with a complex and heterogeneous disease, and gaps are still there. But progress is happening, and in my mind the main message is that understanding the disease is not enough. What is different with respect to the past? I have been working with Sjögren's since 1998, so I live myself this change, is that we are not understanding the disease. We are not only trying to understand better the disease, we are trying to understand the people living with it, and this is the most important change. I have a flight to take at 4 p.m. today, so I won't be there in the wrap-up, but in the last session, we want to focus on how to move from awareness to action to bridge the gap. And these are the two messages that for me are take-home messages. We have a very urgent gap, which is to translate the knowledge that we have, of course to improve the knowledge, but to translate the knowledge into patient-centered management, because we are moving towards personalized and precision medicine. And this is the first step to build continuity of care and to think about personalized medicine, really not only biologically personalized medicine, but humanly personalized medicine. And and that's all, and thank you, and again, thank you for what we can do together.
Thank you.
Thank you so much, Chiara, for your presentation, which I hope everyone understood that is not only a medical presentation, because Chiara is so close to the Sjögren community, and I think you all felt it in our presentation. Thank you again. A couple of remarks from our perspective, I hope for the patient perspective. It is so encouraging to see how far we've come in recent years in research. I really think that Sjögren is no longer invisible as it was. Pain, dryness, fatigue are definitely the hallmark of the disease, and we have it every day. But I'm really convinced that we have made a huge step over these three reducing symptoms, and I really think that the scientific community now has overcome those, again, burdensome symptoms to get further, because that's our daily life. We want the scientists to go further, pain, fatigue, and symptom. So yeah, the gap is diagnosis, the gap is understanding, but it's on the way. We saw a second gap about treatment and research. I think that all the presentation has shown that it is super dynamic. Most of us are today managing the symptoms rather than the disease itself, because we don't have any treatment. So we experience frustration, of course, in trying medication that help, maybe a little, but never enough. So again, Chiara has highlighted the new molecules, and we see that the new drug, we see that yesterday. Another gap from her part is the daily life itself. And again, we really appreciate, Chiara, that you speak about unacceptable symptom burden, because today we don't have any answers for those unacceptable symptom burden. The daily life, yeah, emotional support and mental health, super important topic. We will talk about it later with our two invited specialists. The communication gap, I really think when we started Sjögren Europe in 2019, we have opened the door, really. It was super easy with clinicians that support us since the beginning, but we opened the door. The door were closed for communication. We had doctors on one side, patients on the other side. And we really think at Yoga in Europe that the bridge is now really built and strongly built, and that, again, a lot of hope. What we need today, and Chiara has said it, is more multidisciplinary centers. Because there's a gap everywhere in Europe. All the patients are complaining about the medical burden. We have to take appointments in one hospital. We see a consultant in another hospital. We have physiotherapists to manage. We have many doctors' appointments and so on. So we really need, and we really would like to advocate for more multidisciplinary centers accessible to most of patients, because the research centers, the big ones, offer that kind of multidisciplinary or pluridisciplinary visits, but there are too many in Europe, and all the patients can't access because it's too far from their place. And I think that could alleviate a lot our burden to go from one hospital to ophthalmology clinics and final dentist and go back to the rheumatologist and waiting for the neurologist and the MRI, and we are all living that, and that's a huge part of the burden of the disease that nobody talks about, because it's not a symptom, but it drives us to really a lot of fatigue, mental burden, and everything. So that's another gap we have to fill in few years, and to help for helping patients. So yes, there's still gaps, but there's also a lot of strengths and knowledge in this community. Every patient, we have learned to adapt, to advocate, and to build something that works for us one day at a time, and we are still hoping for the treatment very soon, of course. My hope is that we can keep bridging these gaps together, not only through science and even innovation, but through empathy and shared purpose, because progress in Sjögren's will only be real when every single patient that we represent feel seen, understood, and supported. Thank you.
Thank you. Thank you both for your presentations, for your views. And I think that what we have heard clearly today is that it's not only a gap for the treatment, it's only the gap between connection. We must turn and connect the science and the daily life. This is very important. And what will be our shared goal is to, as Ka said, to turn the awareness, to turn the science into coordination, compassion, and real change to the life of the patient.
Again, we want to encourage, and I think you see now that we have this communication established with our clinicians, with our industry partners who supported in big initiatives. So I think it's, again, something, so don't hesitate to bring to us some topics, some ideas, something to reduce that communication gap in your countries as well. So yeah, we will
ask one question for the public. Okay. So, do you have any questions? Any remark? Do you have any questions? Any remark? Okay. Thank you very much. Sorry to being so strict with the time, but we have to keep the time.
Cathy, our timekeeper.
Yes, we have to keep the time and to respect the time for all the presenters. Otherwise, we're not going to manage all the day without being tired and without having time for our evening networking. This is why I'm just taking the time. And thank you very much for that. Joyce, your floor is yours. Thank you.